Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is proud to bring you this monthly show dedicated to educating you on the programs and services of the agency, as well as bringing you helpful tips to help you stay safe and healthy at home. The National Association of Social Workers is celebrating the month of March as National Social Work Month. So with the theme of All People Matter. And we're going to learn about that today with a social worker from Franklin County Home Health Agency. I've invited with me today Amanda Wilson, who's a social worker at Franklin County Home Health. Thank you for coming today, Amanda.
Thanks for having me.
Sure. So just tell us at first a little bit about yourself, your history at Franklin County Home Health, and maybe how you chose this profession.
Sure. I've only been with Home Health now for about 9 months. Prior to that, I worked in the medical social work field in long-term care. And prior to that, I worked in more of a community-based setting. So home health really has been the setting where I could compile the two, work in the community and work with the aging population. So it's been perfect. I've collaborated a lot with home health in the past in the years of work that I've been doing. So it's been really nice to join the agency and be part of the team.
Nice, thank you. We're happy to have you there. So you mentioned specifically that you've done medical social work. Mm-hmm. So just clarify for our viewers what social work is and how medical social work differentiates from other forms of social work.
Sure. There's a lot of different types of social work. There's child and family social work, there's school social work. So medical social work is a field of social work that focuses on working with people who have illnesses that they maybe are struggling with and helping them to navigate the system and manage coping with those illnesses. Social work can be more clinically based with psychotherapy or more direct service, and medical social work is a direct service field of social work. Mm-hmm. There's also kind of at the macro level of social work where you're more engaged in policy changes in government and legislature and things of that nature.
Mm-hmm. So people interested in this kind of work, if you're going to school, there's so many areas that you can kind of pick your expertise in or your passion for, and you can find something that works for you in social work. Yeah, great. So you talked about medical social work at Franklin County Home Health, helping people with illnesses. So what specific types of direct care and services do you provide?
So we provide a lot of different things to people. It really depends on what they need. I think the first thing that social work team is doing is finding out where the person is at and meeting them where they're at. We're really trying to provide person-centered care and a strength-based perspective. So meeting with the client and the family or whomever's involved, doing an initial assessment, determining what are their strengths, what are their goals, what are their needs. With that assessment, we can then find out and help them access resources so that they can be safe in the community, make referrals to other agencies or other supports that they might need. While we don't provide psychotherapy, we do provide supportive counseling to our clients and our patients, helping them deal with their illness, cope with difficult times, financial stresses, or other things that might be happening in their life. Mm-hmm. We also are all mandated reporters, so part of our role is to identify when someone may be at risk for abuse, neglect, or exploitation, and take the steps to maintain their safety.
Sure, and protect them.
Yep.
So with home health, we've talked a lot about who our types of patients are in home care. We serve people from birth to the end of life. What is your typical client base like, age-wise and the conditions?
Yeah. So there's no age requirement to be a client, though different programs do have different kind of clientele. My particular clients right now, the youngest client that I have is 25, and the oldest is probably in their 90s.
Yeah.
So it's a pretty wide range, and it depends on the type of service that I'm providing to them, what age group they generally fall into.
Can you take us back a minute and talk about your team at Home Health? You have a team of social workers and each of their expertise or whatnot?
Yeah, it's actually been really great to work with Home Health and have a team of social workers. Some agencies, the role of a social worker stands alone and either doesn't have any support or any peers to work with. Here at Home Health, we have 4 full-time social workers that work together very closely, collaborate, and we all do similar things. So we're able to fill in for each other if one is out. We all are trained in all the different areas, the same areas. There's 2 social workers in St. Albans at our office and 2 in Enosburg. So we have geographical areas that we're responsible for, which is nice. You really get to know the community and the supports that are available, natural and more service oriented.
Good. It's a good expertise to have in our community. Another thing with social work, you mentioned one area could be policy changes. How do you and your team stay on top of the current trends or the policy changes and trainings?
Yeah, well, there's a lot happening in Vermont right now with funding and Medicaid changes and all the health insurance across the nation, everywhere. So we have our own responsibility listening to VPR, following the news. We also participate in VAHA quarterly, where we get updates about legislative changes and what's happening. The agency, Home Health Agency, is really supportive in allowing us to pursue extra education, attending trainings. 3 of us attended the gerontology symposium yesterday, which was really great. There's a lot of opportunities, dementia education, hospice and end-of-life care. Really, if we find something that would help us with our growth, that's always been supported.
I'm glad you mentioned hospice. I was going to ask you, to talk a little bit more. You've already hit on it, but what's unique about medical social work in the home care setting? So maybe whether it's the conditions people are dealing with or the patients or dementia, as you said.
Well, our social workers really touch upon 3 areas. So we provide home care. So patients that are typically coming home after a hospital stay or rehab, they have a referral from the doctor, they have a short-term need for social work. It might be assisting them with coping with a current illness that they're facing, doing some long-term planning, accessing funding to help pay for some equipment needs that they have in the home. So we provide that home care service, typically billed to like Medicare, Medicaid, or private insurance. That's a short-term service that we provide. We also do long-term with patients. The Choices for Care program or Medicaid, either Choices for Care or the Moderate Needs program, we're able to follow our clients on a long-term basis.
So these are elderly or people with disabilities who can stay home without going to a nursing home, and what you can do to help them accomplish that?
Yeah, so Medicaid has 2 programs that are really helpful. So the Choices for Care program helps people who are either over the age of 65 or under with a disability. So that's their eligibility. If they require the level of care that meets nursing home level of care, they can actually get those nursing home level of care services in the nursing home, in assisted living, or at home. And part of our role at Home Health is to be their case manager and follow their plan of care, ensure that they're getting what they need no matter what environment they're in. A few years ago, another area of Medicaid was identified that they had this pilot, I think, program to put some funding into a moderate needs group. So identifying people who need a little bit of help, and maybe we could prevent those hospitalizations and those nursing home stays if we gave them a little bit of help ahead of time. So that's the moderate needs group through Medicaid. And we provide case management services for those people as well. So we follow them monthly or quarterly and make sure they have everything they need.
Okay, I was going to ask you, what does it look like for visits for this kind of care? But it's going to depend on the program they're in. But
yeah, the moderate needs group, the requirement is once every 3 months. We all agree that we typically see our clients monthly, at least a phone call every other month. The Choices for Care clients, the requirement is a visit and then a phone call in between. But again, we like to see our clients at least monthly, and it may be more than that that we see them.
Can you talk about a lot of work in home care deals with not just the individual patient, but their team of family members or caregivers or doctors? Can you talk about who else you collaborate with and how that works?
Yeah, we work a lot with families, with children, with spouses, providing them with support, education, how to provide care, how to cope and have stress relief. We collaborate with physicians, long-term care providers. A lot of our clients in the long-term area attend Care Partners, the Adult Day Center, so we work really closely with them. the Department of Aging and Independent Living. We work with transportation companies. There's a lot of
local
anybody,
and
churches,
statewide. Sure,
churches, those natural community supports that can help people, community centers.
Good outreach there.
Yeah.
Let's talk about, with specific to the aging population, as you're mentioning, all the kinds of things they may find help with, but what are the major stressors for that age? What are the things they're dealing with? And then we can talk about other planning for them options.
Sure. And I just want to go back 1 second. When I was talking about home care and long-term care, there's another area that the social workers really focus on, and that's hospice care. So anyone that is on the hospice program, you get social work support. And part of hospice is bereavement support, and we do that for 13 months. So we provide support to the client and the whole family system. So supportive counseling on grieving, anticipatory grief, all of those other things, accessing resources, making sure that the whole team is supported, and then bereavement visits as needed after the person passes away. So we're continuing to support that family system.
That really is, you're caring for that whole system, like
the
you said.
Whole
after
family.
the person passes, you're there for bereavement for up to a year after?
13
months.
Yeah.
That's excellent.
Yeah, and we do a lot of work with hospice.
Yeah.
Good. So I wanted to touch on that, but you were asking about, as people age, I think, some of the things that they're facing. So I think, of course, as people age, the likelihood that they develop an illness, or their body is just facing different difficulties, that's increasing. So we work a lot with people on how to cope with that, how to plan for that, how to identify support so that they can stay safe in their home. As we get older, we're more susceptible to economic difficulties. We work quite a bit with people on identifying resources, financial and natural community supports to help them, whether it's have enough food or buy a new mattress. Their mattress, for whatever reason, is not in good condition. When you're living
quality of life things that you might take for granted
that we all just assume
identify.
that we have. A lot of the folks that we're working with don't have them or have access to them, so we can help them with that.
That's excellent.
The other thing that is really happening with the aging population is, as our population is getting older and people are living longer, we're seeing a lot more diagnosis of dementia and Alzheimer's disease, and that's an aging disease. And I think that social work and the therapies and the nurses, we're all talking about it more, and we're facing it more, and we're having to understand it and be able to provide care in a different way, and provide education to our families and our clients in a different way. So that's something
as that
we're
need
facing.
grows, and you're learning as you go what works for this population and helping. So what kind of things, let's talk about planning for care as we age or as our loved ones age. What do we need to consider, and what steps do we need to take?
So talking about planning early. So when you're in your 30s or your 40s or your 50s, having those conversations with your loved ones. What are your wishes for your end of life, but even the process of getting there? If you get really sick, how would you like that to look? If you need rehab, where would you want to go? So, we plan for having babies, and we plan for going to college, and we plan for getting married, but nobody plans for their long-term needs, for their end of life and what that wants to look like, what they want that to look like. But it's not any less important. And it can be a really supportive period of time, and it can be a beautiful process if we're prepared for it. So Home Health utilizes this Start the Conversation project. So it's a packet of resources and a way of having a conversation. So you open that door up with your family or whomever to start talking about what your goals are, what your preferences are, what's important to you, and it helps you just start a discussion so that it becomes more natural to have those more end-of-life conversations.
And imagine helps you think of things you might not have thought you had to consider, but it can guide you as an individual yourself through those choices.
Yeah, it's a really nice tool to use. I've used it with some of the families that I've worked with, and specifically there's a part of it that talks about goals and preferences. kind of leading into advanced directives, when you're planning on a power of attorney or you're identifying who is going to speak for me in the case that I can't, you want to make sure that the person that you pick understands your goals and your values. And there's a tool in the Start the Conversation packet where each person can fill that out, and then you can compare them and see, do they really know what I would want or what I wouldn't want? It is really great, and I've used it and it works really well. So it's a great tool to use to get to the end result of advanced planning.
So how could individuals access these kind of tools if they're not a client? Or
anybody can call our agency at any time and ask to speak with a social worker or a staff member. Ask the question, you're interested in learning more about advanced directives or the Start the Conversation packet, and they could be directed to anyone that could help them. They can either stop by the office or we can send information out to them. Okay, so that's for individuals interested in, just like you said, to start the conversation, getting some tools to help them have this conversation with families. But just before we move on, tell us one more time about how individuals are referred to medical social work services for home health. So if someone is looking for support from a medical social worker, that's a referral that comes from their doctor. So everything that we're doing, we have doctor's orders for. So either a doctor sends us a referral and has identified that it's a need. The only thing is, to have a medical social worker, it's required that the person also has a skilled service, like nursing or physical therapy. So one of those services has to be involved before a social worker can get involved. So they've already had a referral to home care for another service, and then you can make a... Then we can get in. Yep, we just can't stand alone by ourselves. If someone needs social work type services and they don't have a skilled need, we can help them either over the phone as much as possible. We just can't make home visits, or we can refer them out to the Area on Aging if we need to do that. Good. Well, we're lucky to have this kind of expertise at our agency, and we're also lucky because you yourself have a special expertise in the area of dementia. It's specific to Alzheimer's disease. So I thought we'd take some time to talk about what you've been doing for the Alzheimer's Association and home health regarding training and your expertise there. So. Sure. So a few years ago, I started getting involved in Alzheimer's care and education. I chaired a couple of the walks here in Franklin County, which I absolutely loved, bringing the community together, raising money and awareness. So then I also hosted a support group, and I've recently become involved as a professional community educator. So I've been trained and provided with the tools to educate community members in different areas. So there's recently I've provided a couple of assisted living organizations with training for their staff on the basics of dementia. So it's a PowerPoint presentation with handouts and some videos for examples, and it really walks you through the diagnosis, the symptoms, and how to provide care. There's some other trainings, Know the 10 Warning Signs. Right now I'm in the middle of a 3-part series up at the hospital, a caregiver training, how to provide care to someone. This one in particular is at the middle stages. The Alzheimer's Association has quite a few trainings that are available. They offer the caregiver trainings for people with dementia at the early stages, at the middle stages, and at the late stages, because care is very different at those times. So if we can educate our professionals in the community and our community members about the disease and how to provide good care, it empowers them, gives them the knowledge and the support. A lot of it is teaching people about resources that are available out there. That's great work. I understand you have some fundraising coming up. Do you want to give a little plug for that? Sure. There's a new fundraiser for the Alzheimer's Association. It's called The Longest Day. It's set for June 21st, which is the longest day of the year. Summer is coming. Yep, I'll believe it. Yeah, I believe it when it comes. So anybody can sign up to be a team captain and kind of lead an event. I have committed to being a team captain. Right now we're planning a 16-hour day of hiking. So won't be the whole, you don't have to do the whole 16 hours. You can sign up for some of it. You can hike Hardack that day. You can go for a hike in your backyard. But we will be planning a group hike actually leaving from St. Albans and probably going down to the Middlebury area. It'll be almost a 12 to 13 mile hike. Yeah. So it's going to be a beautiful day. It's going to be a great time. We'll stop for lunch. We'll have a little dinner. And it's to honor folks with Alzheimer's, because their day really is never ending. They don't have the capability to understand where one day starts and another day begins. So we'll be fundraising for that, recruiting participants, team members, and trying to get the word out and educate people about the disease.
Great. So if folks watching want to join you with that, they can call you at the office and find some information about that. Also about your trainings in the community, if there's an agency or an organization that can ask you if there's time you have available to do some of those trainings.
Absolutely. I'm really enjoying doing it. And www.alz.org is a great website. There's so much information there.
That's the Alzheimer's Association.
That is the Alzheimer's Association.
Okay.
Yeah.
Good.
Yeah.
Before we close, I just want to ask you to, maybe you could give us some examples of some of the things a caregiver can keep in mind for stress release or something when they're caring for someone with dementia or a very difficult disease. Can you give us some tips for caregivers?
Yeah, we talk about that a lot in the homes. I think a couple of the first places that we would refer someone to is Franklin County Home Health has a caregiver support group. We also have a grief and bereavement support group. And grief and bereavement doesn't always happen after the loss of somebody. It can happen when a diagnosis occurs. If you get a diagnosis of dementia for your loved one, you're already going to start grieving. You're grieving the loss of the person that you knew. So there's those two really great resources. We also talk just generally about what are your coping skills. How do you relieve your stress? Is it exercise, meditation? There's some really great listening CDs, guided imagery resources out there that I've helped people utilize. Some have liked them, some it hasn't been their thing, but it's trying different things. It's important that people take care of themselves. Caregivers tend to not go to the doctor, not find time for themselves, not sleep well. And if you don't take care of yourself, you can't be a good caregiver. So it's really important. Again, the Alzheimer's Association can be a great resource. They have a 24-hour hotline. When you are a home care patient, we have nurses 24 hours a day. So if there's a crisis about a medication or a condition, don't be scared to call our agency.
We're there to support the patient and the caregivers.
Absolutely. Sure. Yeah.
So the grief and support, or the grief and recovery support group and the caregiver support group, we have links on our website so people can find out the dates those are. They're usually a monthly during the week. So you can go to our website and find the specific dates for those, and anybody's welcome to attend it. They're free of charge.
Yep,
you come
absolutely.
In a group and,
open door.
Yeah, wonderful. So tell us before we end, what's your most, what do you like most about working at Franklin County Home Health and the work you do?
I love really everything about my job. I like being connected to the community. I'm from Franklin County. These are my people. I get it. Yeah. I like being part of a team, collaborating with nursing and therapy and all the different disciplines. I think we have a really good group that communicates really well. We support one another. If there's a difficult client, I can go to my peers. I can go to my social work team. I can talk to another discipline, but Janet, our executive director, is super supportive and her door is always open. So that's been a really, really great experience.
Good. We're so glad you're with us, Amanda, and thank you for sharing today.
Thank
you
so much.
for caring for people in our community. As the National Social Work Month theme, all people matter, and it's clear in all these conditions that all people matter, and you do wonderful care for them. So thank you so much.
Thanks for having me.
Sure. And if you have any questions about medical social work or the services of Franklin County Home Health Agency, you can call the agency at 527-7531, or you can visit us online at www.fchha.org, and you can find out how to support the work of the agency through different events. For instance, we have a fundraising event every fall, the Blue Jean Ball, and we're starting to plan for that now as well. You'll be hearing more about that. Thank you for watching, and again, if you have any questions, call our agency or find us online. Have a great day and be well.